Ever stop to think about something as simple as lifting your morning coffee? It feels like nothing, right? But behind that one little motion is an absolute masterpiece of biomechanical engineering. And today, we're going to take a deep dive into that incredible bit of natural machinery. Let's get right into it. And here's where things get really interesting. The elbow isn't just one simple hinge. No way. It's actually a super complex system of bones, ligaments, and muscles, all working together in perfect harmony. And in this explainer, we're going to deconstruct it piece by piece.
So, here's our game plan. We'll start with the basic building blocks, then check out the support system that holds it all together. After that, we'll look at the muscles that actually make it move. And finally, we'll explore what happens when this complex machine runs into some trouble.
All right, first up, let's meet the core components, the fundamental building blocks of the elbow complex.
Okay, so at its heart, the elbow is what's known as a hinge-type synovial joint. Now, synovial is just a fancy word meaning the joint has its own built-in lubricating fluid, which is what helps it move so smoothly. But honestly, the easiest way to think about it is like a door hinge. Its main job, its whole purpose, is that clean bending and straightening motion.
So this hinge is where three key bones come together. You've got the humerus, that's your upper arm bone. Then in your forearm, you've got two bones working as a team, the radius, which is on the thumb side, and the ulna, on the pinky side. It's the really unique way these three bones are shaped and how they fit together that makes all the elbow's amazing movements possible.
But of course, bones can't just float around on their own, right? They need a really strong support system to hold them together and keep them stable. And that's where all the ligaments and other soft tissues come into play.
I want you to think of these two ligaments like guide ropes on a tent. You've got the ulnar collateral ligament on the inside of your elbow and the radiocollateral ligament on the outside. Together, they provide all that crucial side-to-side stability. They are literally the reason your elbow doesn't bend sideways.
And this brings us to one of the absolute coolest features of the elbow, the annular ligament. It's this incredible, unique ring of tissue that, and this is the best part, acts like a lasso. It literally wraps around the top of the radius bone, holding it nice and snug against the ulna. This simple little lasso is the key that unlocks your forearm's ability to twist and turn. So cool.
So we have the bones giving us the structure and the ligaments providing the support. Now we need the engine. Let's take a look at the muscles that power the elbow's four main movements.
For that classic hinge motion, it's basically a tug of war between two opposing teams. To bend the elbow, what we call flexion, you've got a team led by the famous biceps, with some help from a couple of other muscles you see there. Then, to straighten it back out, or extend it, the triceps muscle on the back of your arm does all the heavy lifting. It's a perfect push-pull system. So, what about that twisting action? Well, turning your palm down, that's called pronation, is handled by the pronator muscles. And to turn your palm back up, a move called supination, you use your supinator muscle. And get this, your biceps actually helps out here too. Here's an easy way to remember it. Think of holding a bowl of soup in your palm. That's supination.
Okay, so we've talked about the kinds of movement, but how much can the elbow actually move? Let's go ahead and put some numbers to these actions.
For flexion, the bending motion, a healthy elbow has this fantastic range of motion, somewhere between 135 and 150 degrees. That is a huge range, and it's what lets you do all the simple stuff like touching your shoulder, eating, or brushing your hair without even thinking about it.
Now for extension, or straightening, the range looks a lot smaller, right? Basically 0 to 5 degrees. And there's a really good reason for that. Your arm is designed to stop when it's straight. The bony part of your ulna actually fits right into a groove on the humerus, creating a hard stop that prevents your elbow from bending backwards.
And what about that all-important twisting motion we keep talking about? Well, you can typically rotate your forearm with a palm up, that's supination, about 80 to 90 degrees. And with a palm down, pronation, about 75 to 85 degrees. It's this range of motion that lets us do everything from turning a key in a lock to using a screwdriver. So, we have this beautifully designed, complex joint. But, just like any intricate machine, sometimes things can go wrong. Let's take a quick look at a few of the more common problems. You've probably heard of these too. Tennis elbow and golfer's elbow are two of the most common issues, and they are pretty much mirror images of each other. Tennis elbow gives you pain on the outer part of your elbow, and it's caused by overusing the muscles that pull your wrist back. Golfer's elbow, on the other hand, is pain on the inner elbow from overusing the muscles that curl your wrist forward. Hey, remember that lasso-like annular ligament we thought was so cool? Well, in small children, that ligament isn't fully developed yet. It's a little loose.
So, if an adult pulls a child up by one arm, the head of that radius bone can actually slip right out of the lasso. We call it nursemaid's elbow, and it's a perfect example of how knowing the anatomy helps us understand exactly how an injury can happen. And just to round things out, here are two more interesting little quirks of the elbow. First, ever notice how your arms don't hang perfectly straight down? That natural outward angle is called the carrying angle, and it's usually a bit wider in women than in men. And second, you know when you hit your funny bone? Well, it's not a bone at all. It's actually your ulnar nerve. And when that nerve gets pinched or compressed, it can cause a condition called cubital tunnel syndrome.
When you really stop and look at it, from its bony structure to its intricate system of ligaments and muscles, the elbow allows for this incredible combination of stability and mobility. It's truly a biomechanical marvel that we rely on constantly, every single day. So the question this all leaves us with is, knowing how beautifully it's all put together, how can we do a better job of protecting this critical joint in everything we do?